High blood pressure, or hypertension, is a common health condition characterized by elevated blood pressure levels that can significantly increase the risk of cardiovascular diseases such as heart attacks and strokes. While medications and lifestyle modifications play a crucial role in managing hypertension, dietary factors also have a profound impact on blood pressure levels. In this comprehensive exploration, we will delve into the foods and beverages that individuals with high blood pressure should avoid, shedding light on their potential to exacerbate hypertension and compromise cardiovascular health. Sodium-rich foods. Excessive sodium intake is a well-known contributor to high blood pressure, as it can lead to fluid retention and increased blood volume, putting added strain on the heart and blood vessels. Foods high in sodium include processed and packaged foods, such as canned soups, processed meats and fast food. Individuals with high blood pressure should aim to limit their sodium intake to less than 2,300 mg per day, or even lower if advised by a healthcare professional. High sodium condiments. Condiments and sauces can significantly contribute to sodium intake, even in small quantities. Common high-sodium condiments to avoid or use sparingly include soy sauce, teriyaki sauce, ketchup, barbecue sauce, and salad dressings. Instead, individuals with high blood pressure can opt for low-sodium or sodium-free versions of these condiments, or use herbs, spices, vinegar, and citrus juices to add flavor to their meals without increasing sodium intake. Caffeinated beverages. Caffeine is a stimulant found in coffee, tea, energy drinks, and certain sodas that can temporarily raise blood pressure levels by stimulating the release of stress hormones like adrenaline. While moderate caffeine consumption is generally safe for most individuals, excessive intake can lead to sustained increases in blood pressure, particularly in sensitive individuals. Individuals with high blood pressure should limit their caffeine intake to no more than 400 mg per day, equivalent to about 2 to 3 cups of coffee. Alcohol. Alcohol consumption can have complex effects on blood pressure, depending on factors such as the amount consumed, individual sensitivity, and underlying health conditions. Excessive alcohol intake can raise blood pressure levels and increase the risk of hypertension and other cardiovascular diseases. Individuals with high blood pressure should limit their alcohol intake and avoid binge drinking. High sugar foods and beverages. Consuming foods and beverages high in added sugars can contribute to weight gain, insulin resistance, and hypertension, as well as increase the risk of developing type 2 diabetes and other metabolic disorders. High sugar foods and beverages to avoid include sugary sodas, fruit juices, energy drinks, candy, pastries, and desserts. Instead, individuals with high blood pressure should prioritize whole, unprocessed foods and opt for naturally sweetened alternatives such as fresh fruits, unsweetened beverages, and homemade treats sweetened with natural sweeteners like honey or maple syrup. Processed and packaged foods. Processed and packaged foods are often high in sodium, added sugars, unhealthy fats, and other additives that can contribute to hypertension and other cardiovascular diseases. Common processed foods to avoid include frozen meals, instant noodles, canned soups, packaged snacks, and pre-packaged deli meats. Instead, individuals with high blood pressure should focus on preparing homemade meals using fresh, whole ingredients and limiting their intake of processed and packaged foods as much as possible. Fried foods. Fried foods, such as French fries, fried chicken, and fried fish, are typically high in unhealthy fats, calories, and sodium, making them detrimental to cardiovascular health, including blood pressure. Consuming fried foods regularly can lead to weight gain, insulin resistance, and inflammation, all of which can contribute to hypertension and increase the risk of heart disease. Individuals with high blood pressure should limit their consumption of fried foods and opt for healthier cooking methods such as baking, grilling, steaming, or sautéing with minimal added fats. High-fat dairy products. Full-fat dairy products, such as whole milk, cheese, butter, and cream, are high in saturated fats, which can raise LDL, bad cholesterol levels and increase the risk of hypertension and cardiovascular disease. Individuals with high blood pressure should opt for low-fat or fat-free dairy products, such as skim milk, low-fat yogurt, and reduced-fat cheese, to reduce their intake of saturated fats and promote heart health. Canned foods, including soups, vegetables, and beans, often contain high amounts of sodium as a preservative. Consuming canned foods regularly can contribute to sodium intake and exacerbate hypertension. While some canned foods offer convenience and long shelf life, individuals with high blood pressure should choose low sodium or no salt added varieties whenever possible. Alternatively, they can opt for fresh or frozen fruits and vegetables, which are naturally low in sodium and offer comparable nutritional benefits. Pickled foods, such as pickles, olives, and sauerkraut, are preserved in brine, which is high in sodium. Consuming pickled foods regularly can contribute to sodium intake and raise blood pressure levels. While pickled foods can add flavor to meals, individuals with high blood pressure should consume them in moderation and be mindful of portion sizes. They can also opt for low sodium or homemade pickled foods to reduce their sodium intake and support blood pressure management. Baked goods and pastries, such as cakes, cookies, pastries, and pies, are often high in added sugars, unhealthy fats, and refined carbohydrates, which can contribute to weight gain, insulin resistance, and hypertension. Consuming baked goods and pastries regularly can lead to elevated blood sugar levels and increase the risk of developing cardiovascular diseases. Individuals with high blood pressure should limit their intake of baked goods and pastries and opt for healthier alternatives such as whole grain products, fruit-based desserts, and homemade treats made with healthier ingredients. Fast food, including burgers, fries, pizza, and fried chicken, is notoriously high in unhealthy fats, sodium, and calories, making it detrimental to cardiovascular health, including blood pressure. Consuming fast food regularly can lead to weight gain, insulin resistance, and elevated blood pressure levels. Individuals with high blood pressure should limit their consumption of fast food and opt for healthier options such as salads, grilled chicken sandwiches, and vegetable-based dishes when dining out. Sweetened beverages, such as sodas, fruit juices, energy drinks, and sweetened teas, are loaded with added sugars, which can contribute to weight gain, insulin resistance, and hypertension. Consuming sweetened beverages regularly can lead to spikes in blood sugar levels and increase the risk of developing cardiovascular diseases. Individuals with high blood pressure should limit their intake of sweetened beverages and opt for water, unsweetened tea, or sparkling water flavored with fresh fruit as healthier alternatives. In conclusion, managing high blood pressure requires a multifaceted approach that includes dietary modifications, lifestyle changes, and, in some cases, medication. By avoiding foods and beverages that can exacerbate hypertension, individuals with high blood pressure can better control their blood pressure levels and reduce their risk of cardiovascular complications. Incorporating a balanced diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats can help support overall cardiovascular health and promote blood pressure regulation. Additionally, individuals with high blood pressure should consult with a healthcare professional or registered dietitian for personalized dietary recommendations and guidance on managing their condition effectively.